This clip is about biomechanics of injury in intervertebral disc. Human spine has three regions: cervical spine, thoracic spine, and the lumbar spine. The cervical spine is near the neck, the thoracic spine is near the rib cage, and it is interconnected with the rib cage, and the lumbar spine is near the abdominal area. An intervertebral disc lies between two bony vertebrae. And if we look at them more closely, at the top and bottom, we have the vertebral bodies, which are made of bones and they are hard tissue. And in between, we have the intervertebral disc, which is a soft tissue. And if we section it horizontally, at the middle, we have the nucleus pulposus, which has a gel-like structure. It's like a liquid. And on the outer rim, we have the annulus fibrosus. Annulus fibrosus has a layered structure like an onion, and if we look at two adjacent lamellae, they are made of collagen fibers with alternating angle. In one layer, collagen fibers are highly organized in one direction, and in the next lamellae, they have another alternating angle. So if we look at the annulus fibrosus along this direction, we can see how the angle of collagen fibers changes. These are two photon images of annulus fibrosus. In one layer, the collagen fibers are highly organized along this direction, and in the next lamellae, they have entirely another orientation. And this image is particularly interesting because here you can see both lamellae at the same time and how the angle of collagen fibers changes. This is a 3D reconstructed geometry of collagen bundles in annulus fibrosus, and you can see how they have packed closely alongside each other. The spine carries our own weight and any additional load that we carry during daily activity. And if we do any physical task, muscles are activated and the external loads along with muscle forces are carried by the spine. If we break down these resultant forces, the intervertebral discs are under compression and shear forces. There is no direct way to measure spinal loads, and all existing methods are indirect and invasive. One of the methods is you measuring intradiscal pressure. This is a very invasive procedure in which a researcher insert a pressure sensor to the nucleus pulposus of the subject. And during this procedure, the needle or pressure gauge go all the way through until it is inserted or placed at the right place at the middle of the intervertebral disc. By using intradiscal pressure measurements and this equation, we can estimate spinal compression. The spinal compression during these lifting activities has been estimated from 2000 Newton to 5000 Newton. So the spine and intervertebral discs are under rather large mechanical loads. Those rather large forces are carried through different components in the spine, through the facet joints, ligaments, as well as intervertebral disc. The intervertebral disc has been estimated to carry about 60% of the applied load. So, depending on the posture and the loading, overall we can say that about 60% of the force is carried through the intervertebral disc. So an intervertebral disc is under large mechanical loads, and the remaining question is that how the load is distributed within the intervertebral disc. By inserting a pressure sensors in the intervertebral disc while recording the pressure values, one can estimate load distribution in a disc. In a healthy disk or non-degenerated disk, the load distribution is rather smooth all over the place, which has a flat plateau in the middle. But in the degenerated disk, there are lots of peaks, and it's not as smooth as the healthy disk. And there are multiple peaks showing the signs of stress concentration in a degenerated intervertebral disc. Biomechanical injury can happen in the disc due to three different pathways. The first one is overloading, the second one is instability, and the last one is fatigue loading or cyclic loading. Injury due to overloading takes place in a single cycle, so a very large load due to accidents or a high demand physical activity is applied to the intervertebral disc and injury takes place. So the applied load is much larger than the strength of the tissue and the injury happens. The strength of annulus fibrosus is proportional to its collagen content. For example, here a modeling study have shown that by increasing the collagen content or how much collagen we have in the annulus fibrosus, the elastic modulus of it and the failure stress or the strength of the tissue increases linearly. But with aging and degeneration, the strength of the tissue decreases. For instance, 66% of the strength of the tissue deteriorates due to aging and degeneration. Another mode of failure is spinal instability. Spine without muscles buckles under 80 Newton compression load. So muscles play a significant role here because during in vivo condition, spine reaches to very large mechanical loads, compressions easily exceeding 1000 Newton, reaching to 6000 Newton compression. So here the role of muscles are critical to provide an stability. But the question is how an instability happens. When instability happens, this is different from overloading. And the mechanical loads are much lower than the critical load or the failure threshold of the tissue. And this happens mainly because a muscle or a group of muscles are not properly activated due to miscoordination, fatigue, nerve damage, or sensory problem. So a muscle is not activated, and this lack of activation would cause excessive motion in one direction and instability and damage. The next mode of failure is cyclic loading. And the cyclic loading, the applied loads always remain less than the critical load. So the applied load is always much lower than the failure load, but it is applied cyclically for hundreds of thousands of cycles. And this has been shown to cause injury or rupture in the tissue. For example, if you apply 60% of the critical threshold, which causes it will cause the damage or rupture in the tissue after 1000 cycles. So if you apply sub-failure loading, but if you apply it cyclically long enough, this will cause injury in the tissue. So overusing the spine also can cause a biomechanical injury. So intervertebral discs are under large mechanical load, and these loads can easily exceed 1000 Newton. And the injury in the spine can take place due to three reasons. Overloading, which means that a very significant mechanical load is applied to the spine, which can be due to accident, for example, in a car crash, or someone lifts a very large load. And the next mechanism for spinal injury is instability, which is due to inappropriate or lack of activation in a muscle or a group of muscles. So when a muscle is not activated properly, this can lead to excessive motion in a segment and therefore a spinal instability or segmental instability. The last mode of failure or biomechanical failure is cyclic loading. In this mode of failure, the applied load never reaches to the critical level, but it is applied cyclically for a long period of time, long enough which can cause or initiate injury.